So I want to talk to you guys about evaluation methods and remediation. So we're going to talk about a number of things, including what it means to assess learning, how to distinguish between formative, which is low stakes evaluation, and a summative or a high stakes learning evaluation. What are the terms reliability and validity mean? We're going to talk about cognitive, affective, and psychomotor evaluations, and then also some remediation techniques. So assessment is the process of determining whether a student has successfully acquired new capabilities, and we can also call this an evaluation. So there's a lot of ways that we can do that. We can do it through formal evaluation, through informal evaluation, and then each one of those learning domains has their own way that we can evaluate as well. So informal evaluation is going to be questions delivered in class or homework. So asking questions just to get a response, or maybe they're rhetorical questions for you to provide the answer to. Homework questions, something where they don't necessarily have to know the answer. They're looking up the answer. This lacks the rigor necessary to justify decisions made regarding student competency or pass-fail status. That means from one pop quiz in class or one homework assignment, no matter the student's outcome on that, that's not going to be enough to get them thrown out of a program. And so we want to make sure that we know what's the difference between these formal and informal methods and what are the purpose of these. So the purpose of informal evaluation is to provide immediate feedback regarding the instructional effectiveness. Now, these evaluations are going to tell you a lot about the student, but they're also going to tell you a lot about the instructor and the evaluation methods and how the class was delivered. So a lot of information to be gained when you're doing an informal evaluation. So you can use these to help the student. Okay, so when they don't know the answer to questions, this is the time to help. This is the time to correct. This is the time to teach. This is the time to form. All right. When we move on to formal evaluations, like a final exam or a final technical scope of practice evaluation, those are used to determine a grade, a pass or fail of the class. No immediate feedback is provided. The student is expected to be proficient at this point. They've had an opportunity, hopefully, to have some informal evaluation and to get some feedback and to progress and remediate. But this formal evaluation is simply going to be pass or fail in a lot of cases. And something like this would be grounds to have a student say whether they are successful or not in a program. So the formative assessment is that ongoing evaluation of a student performance throughout a course. And the intent here, like we said, is to provide feedback to students and instructors regarding their progress. And this allows the instructor to modify the course if needed or provide remediation. So maybe if you give out a homework assignment and you see that the entire class did poorly, not just one or two students, this should let you know that the material was not covered the way that it should be. It wasn't covered effectively. So if you had an adjunct instructor who did that, or even if it was yourself, then you see the students obviously didn't grasp what you had to say, or it wasn't delivered in a format that was helpful to them. So take this opportunity to cover that material again. Go back over it. Redo that PowerPoint. Re-lecture the material. Make a Kahoot quiz to talk about some things in class. Whatever you need to do to talk about the material and help everybody understand. With summative assessments, these are the evaluations given to the student at the end of a course or at the end of a unit within a course. And these are used to determine whether the terminal goals and objectives of the course or unit were met. And the feedback is more used to mold future courses and change how you might do things in the future, not necessarily for this one particular student. Now, in terms of formative versus summative testing, then the summative assessment is going to be like a unit exam or a final exam, where these are heavily weighted, usually high stakes, could alter their performance in the course. When we're talking about formative and summative, scenarios or simulations, it kind of has the same concept. If we're running an informal scenario or a formative assessment in class, then I'm going to stop the student if they're doing something critical. I'm going to provide some feedback at the end. I'm going to let them know what they were doing right and wrong. At the summative assessment, and we'll just use like a final scenario for ACLS or PHTLS or final scenarios in class to determine graduation. Those are summative assessments. That means that if the student fails those, they fail them. Now, they might have the opportunity to remediate, which we're going to get to here in just a second, but that's a pass or a fail. This is not an opportunity to learn something from those because they should have already mastered that material by this point. So again, formative and summative, formative being more low stake, so has relatively little effect on whether a student passes the course. These are like classroom quizzes, homework assignments, those informal scenarios that we're running, and these help to prepare students for high stakes evaluation. And so whatever you're doing in the low stake evaluation or the formative evaluation, that's what they're going to get used to. And so specifically with written assignments, which we're going to get to here in just a moment, we've got to prepare them for those high stakes. If we're not asking questions the same way that we will be in a high stake exam, they're not going to be prepared. And so that's why we have got to gear them up for that from the very beginning. Those summative evaluations are considered high stakes, and this is the student's continuation in the program depending on these things. And so a final exam or a TSAT final scenario are going to be considered high stake. Ultimately, the highest stake is going to be your certification or licensure exam, and that's ultimately what we're all gearing up for, whether that's state or national registry. And these do require a lot more careful construction, so we've got to be careful with how we write these. A certain number of people have to sign off on these scenarios, on these exams. You have to have the right type of person to evaluate. You got to have everything you need to run through that scenario or the right amount of time allotted for the exam. There's a lot more scrutiny on these high stakes or summative evaluations. And this is just a progression, and this is just simply the cognitive domain that we're looking at here, because it's talking about asking questions, quizzes, exams, things like that, which you're going to assess the cognitive, not the psychomotor here. So again, the lowest stake being just simply asking questions in class and then moving up through homework, quizzes, unit exams. The highest stake for your classroom is going to be your final exam or pass and fail of the course. But ultimate highest stake is going to be your licensure or certification exam, which is ultimately what we are preparing each student that comes through our program for. Now, we got to make sure that we have valid and reliable tests. And so looking specifically at reliability for an examination to be appropriate, then it must measure consistently. That means it's measuring consistently the same amount of information. So a reliable exam would produce similar results in the same student repeatedly if they were to take the exam again. So that means if I made an 85 on an exam today and I took it again tomorrow, I would still pretty reasonably make around that same grade. I might make a little bit higher, having been exposed to the questions before, but probably going to be close to the same grade. It also means that you'll probably see similar results in different students who have mastered the same material to the same degree. So while you might see one or two students who maybe don't meet that total curve, that's not uncommon, but if you see that the majority of the class is missing the same questions or the same material, again, that's an opportunity for you as the instructor to go back and correct that and relearn some material, reteach some material. And so one of the things that I like to do, and I don't do this with every quiz that I give, because again, they're more low stakes. If I give quizzes in Blackboard, generally the students are able to see the answers when they can see what they got right and wrong at the end. With Platinum Planner, because we have to utilize what's called secure testing, they can never see what they got right and wrong. I can see it on the instructor side of things, but I can't release that information to them, so they don't get immediate feedback. And really, We can discuss it in class, which is what I'm getting at, but they don't see specifically what they got right and wrong, and that's to keep the test secure. All right, so what I try to do for their big exams, and each EMT class has a total of 7 unit exams, and when they get to those, what I like to do is go over them in class, and any question that 50% or more of the class missed, then we'll talk about and go over in class, and that's a really good rule of thumb to make sure that your tests are both reliable and also valid, which we're going to get to here in just a second. And so doing this is actually a recommendation of COAMPS, to our national accrediting body. That's something that they recommend. So 50% or more missed the question. And with the Platinum Planner breakdown, what it does is show you how many students got these questions right. So if there are 20 students in a class, it would break it down and say 8 students answered A and 4 students answered B, and so on and so forth, so that you could see maybe why the students chose that. Did you say something, or was there something conflicting in the material that would lead more students to believe, and get confused on what the answer was there? So some things to consider. Now, looking at validity, an exam must measure the knowledge, skills, or abilities that is intended to evaluate. So that's what validity means. So that means we can't ask a bunch of questions about how to change a tire if what we said our objective was to measure, is the student able to perform a head tilt chin lift. Okay, so you got to make sure that your questions are related to the material that you are intending to cover and that the questions make sense. So reviewing the exam with your colleagues to make sure that items and questions make sense is known as face validity. Okay, and usually when I'm creating a test, even if it's out of the test bank, I will still read through every single question, every single answer choice to make sure that it makes sense and that it's not too confusing. Now, are there some instances where there is more than one potentially correct answer? Yes, and we're going to get into that in just a second. But we need to make sure that the student should be able to decipher the answer based off of what we know we have taught them. And then you can sit down with some colleagues and read through those questions and again determine, is this test valid? Because you might be a question that needs to be thrown out. And this is something that if you're going to continue to use the same tests for a number of semesters, that it needs to be done every semester to look at the students. Is there a particular reason why more students got this wrong? Do we need to go back and cover this material? Was it not covered thoroughly in class? That type of thing. Now, content validity refers to the extent to which the examination items accurately represent the wider body of knowledge that is being tested. So, do the objectives match the questions that are being asked? When you set out to teach material, were the objectives that you intended to teach this body of students, do they match the types of questions that are being asked? And do those questions have the ability to gauge that knowledge? And then, to what degree? So if you're reading those goals and objectives, things that we talked about previously, and you're trying to set those, adding the degree. So not just saying, I know how to insert a king tube, but being able to specifically say that I am able to put in a king tube correctly. How much percent of the time? That's setting a degree. Can I do it 50% of the time, 80% of the time, 100% of the time without assistance? Those are the degrees that you're looking at when you're trying to measure how much mastery does the student have. So what is the purpose of your assessment? So very important that we know why we are conducting the assessment and what we're going to do with the results. So let's look at a couple of examples here. Example 1 says, does the student have the skills and knowledge to move into the clinical environment? So the purpose is going to lead to a summative tool with high stakes, okay? So high stakes meaning you can or you cannot go into clinicals, and if you can't, then you can't progress in the program. So this is high stakes. And I use the example of patient assessment skill checkoff or scenario because that's one of the things that students have to have been completely proficient in prior to going to clinicals is their patient assessment skill checkoff. And it includes aspects of competency verification, which results in the need for assessments with predictive validity. So basically what this means is that we have got to have some type of evaluation, some set of standards to say, is the student ready to move into the clinical environment, yes or no? And the competency verification, meaning do you have the same amount of students with that predictive validity that would be able to answer these same questions or perform these same skills based off of the same knowledge if they, is everyone across the board receiving that same knowledge and have that understanding? Because things that we can't predict are like the student's outside experience. How much reading are they doing at home on their own? Are they getting outside help? Do they already have experience or family with experience in a particular area? So those are things that we can't really predict and control, and we're just trying to look at the validity of an exam or testing purpose. Now, example 2 is the student competent to work independently as a provider? And this purpose requires that a test be based on a practice analysis instead of on course objectives. So, for example, a unit test would not be a definitive or valid way of testing this. And obviously, this is high stakes. This would be something taken at the end of a course, like a final exam, to determine, do you have a base knowledge not just on one set of skills or one area of information, but are you ready to leave this program in practice as an independent provider? And usually we check that in a variety of ways: final exam and technical scope of practicing, coupled with the affective evaluation by clinical preceptors. And then example number 3 is the student progressing toward mastery of the material. And this is formative, which means it's low stakes. Okay, so we're doing a skills evaluation. We're checking to see, is the student complete with this? There's nothing weighing on it. They're not going to not get into clinicals or get kicked out of the program if they get this one skill wrong. And the greater emphasis here is on providing feedback to the student. So this isn't necessarily just about pass or fail. It's about evaluating how are they performing these skills and how can you help them develop them further? How can you help them master them more? And so all of these giving you 3 separate examples of what is the purpose, what are you hoping to gain, and then what are you going to do with the information that you get? Because once you have that, it's going to help you either write your test questions or create your scenarios or create your goals and objectives for your program, whatever the case is that you're trying to build with this information. So I'm going to stop this portion of the video here, and I will catch you guys in the next part.